Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the closed impression technique. This is part 2. In part 1 we have already discussed in brief about all the implant impression technique. Now we'll discuss about the closed implant impression technique, their steps, how we will take closed impression technique in detail. Okay, then let's begin the video. First of all, what is closed impression technique or indirect technique? In this technique, impression coping remain attached to the implant during impression taking. So look at the figure. This is we have a closed ray coping, and in second figure you can see after impression coping is remain in the patient mouth, and in impression we have a indentation of that coping. Now what we are going to do after setting, the impression tray is taken out from the patient mouth and coping is attached to the analog and then reinstall in the impression. Coping is not pick up along with the impression, it is reinstalled. That is why it is called indirect impression technique. Now what are the steps in the impression tray technique, closed tray impression tray technique? So after second stage surgery gingival formers are placed, and then after 1 week we'll remove the healing cap or the gingival former. As you can see in the image, gingival formers are already placed. We are going to remove the gingival former before taking the impression. Now we are going to attach a closed impression coping to the each implants very carefully. As you can see in the image, each and every implants are covered with the closed tray impression coping, and ensure that there is a correct and complete placement of the coping, not a partial. After placement of coping, now we are going to take an impression. For impression, we are using a silicone putty and the light body. You can see in the image, we have a putty in the green and the light body in the orange. And we are going to inject a little amount of light body impression material around the coping. Now place the impression tray into the patient mouth filled with the impression material. Hold the tray in the place until material completely set. Once material completely set, remove the impression from the patient mouth, and as you can see in the second image, impression coping will remain in the patient mouth. Now we are going to remove the impression coping and connect it to the lab analog, as you can see in the image. To know about the implant component, that what is impression coping, lab analog, I have already posted a video. I'll share the link. Now put coping analog assembly to its original place within the impression. Now impression coping and lab analog assembly is placed within the impression. So as you can see, coping is not directly pick up with the impression, it is reinserted. That is why it is an indirect impression technique, not a direct one. Now we'll pour an impression and fabricate a working model. So on working model, we have a pink color gingival mask. It is a replica of natural gum tissue surrounding an implant in the patient mouth. Then we have a lab analog. And what is lab analog? It is a replica of dental implant used for prosthesis fabrication. Then we have a abutment. We'll remove impression coping and attach abutment to the analog for prosthesis fabrication. And over the abutment, prosthesis is fabricated. And this is a whole procedure involved in closed tray impression coping impression technique till the prosthesis fabrication. I think it is very well clear to you how to take an impression with a closed tray impression coping. Now pros and cons of closed tray impression technique. First, pros: simpler and faster technique, preferred for single implants because of inaccuracy in repositioning the coping, and cases with good access. Now the cons: less accurate because of repositioning and cannot be used for multiple implants. I hope this video is helpful for you to understand closed tray impression technique. In part 3, I'll tell you the open tray impression technique, and if you want clinical video related to closed tray implant impression technique, comment on comment section. I'll definitely post a video.